Hi guys, this is Bryce from HFHill. Again, we're doing another installment of our educational videos. I've got Dr. Chris Prue from Chattanooga. He's our clinical educator. He's going to tell you a little bit more about the Chattanooga Cube 4 Plus laser. Dr.
Cool.
Prue?
Thanks, Bryce. So first off, why laser? Well, laser has a lot of capability to it. It has a lot of biochemical effects, also referred to as biomodulation. So it means it can be excitatory and it can be inhibitory, which confuses a lot of people. So excitatory means it can activate certain things. Inhibitory means it can suppress certain things, such as pain. Pain is a really big reason to use something like a laser, and in particular using a high-powered laser. So a high-power laser versus a low-power laser really gives us more energy to deliver more of the dosage to a deeper amount of penetration, as well as cover larger surface areas. Especially when it comes to dealing with pain, the larger the surface area surrounding sort of that area of pathology, the greater the stimulation of superficial tissue such as skin, which we know from electrotherapy and other types of physical agents, has a really good and a large impact on reducing pain and how it gets stimulated, depolarizing superficial free nerve endings as it makes its way up to the spine. The difference with laser is it actually makes its way all the way up to the cortex. So as we get into the brain, it also helps to stimulate opioids, right, in a natural form. That's really important because opioids give us a long-lasting pain relief effect. So it changes the competition as we get up into the cortex and releases the same chemicals in a similar fashion that taking a pain medications, especially an opioid. So right now, what we're trying to accomplish is managing certainly the opioid crisis, but if we can do it in a way where we can't, not allowed to use opioids, don't want to use opioids, it really allows us to mitigate that pain from a, I don't want to call it a holistic or more natural, but that's exactly what it is. So within the clinic, when we manage pain, it allows us to perform some of the other therapies. The patient will be more relaxed. Being out of pain allows them to also perform some of their more active therapies. So if you're having them do physical rehabilitation, think about manipulation. If you're doing chiropractic manipulation therapy, then it means that they're going to be more relaxed. It's going to be easier to get them into the various positions, and by being more relaxed, it doesn't require as much force from me. That actually makes it better. So I don't have to work as hard, so that's good for the clinician as well. Not having to use as much force and potentially with less resistance being faster, it might also decrease, the potential adverse response from that. So being able to cover larger surface areas and get to a greater depth of penetration, other than stimulating the superficial areas such as the skin, because I can deliver with high power laser more energy to a depth of penetration, it also allows me to facilitate changes biochemically. So removing things like substance P and bradykinin, those chemical mediators associated with acute pain. And then we can look at chronic pain too. So the nice thing is, because of the way it stimulates superficial free nerve endings and the nervous system, it also facilitates a reduction in chronic pain. And then because it's a high power laser, it also generates a certain amount of thermal energy. And by doing that, now we get that sensory effect, which is different than using a low power laser. So we've sort of added to the potential opportunity to mitigate that pain really by all those factors. And so when it comes to an acute type of pain, the majority of that pain is actually associated with the inflammatory response, all of those chemicals. We can do that. Also in the chronic aspect, because of the way that we can stimulate and make its way up to the cortex, using that thermal implication of energy, so now the patient can also feel it. Now we get more additions to how we can also mitigate that pain. The other nice thing about the benefit of laser, especially during that acute phase when we think, our goal is to manage pain, we're also getting the benefits of the other components of laser, which we won't cover every single one of those right now, but what I think is a really powerful tool, and how it stimulates what's referred to as reactive oxygen species, right? It's a fancy way of saying it does something to the oxygen, so it really does assist with creating chemical energy as far as healing goes, which is a nice thing, and maybe a discussion for another day. But if we think about, the side effect of managing conditions following the injury, one of the concerns that we have too is the development of scar tissue formation. So laser does a really good job, even during that acute stage when we're trying to mitigate pain, at metabolizing these reactive oxygen species that aren't being used for good and hanging out where they can actually translate into formation of scar tissue. We actually get to assist in mitigating that. It's a process through superoxide dismutase. It's a chemical mediator that we could measure, and it's been shown to be affected by the use of laser. The other nice thing too is when we're in those stages of tissue proliferation, it's also been shown to create ultimate tensile strength of tissue. In other words, creating a biasing of tissue when normally that actually took a mechanical form of energy, once we start getting into movement, range of motion, active range of motion, resisted range of motion, stretching, and those sorts of things. So it certainly does have its impact on pain, but you're also getting a lot of benefits that you may not see in some of the areas. The overall treatment times in mitigating pain, if you're just treating pain, they're relatively short, even with a high power laser. This one in particular allows me to treat with large amounts of energy in relatively short periods of time. Because of the multiple wavelengths, one of them being the 660 really allows a certain focus and dedication superficially, and then those other ones give us a relatively deeper penetration to facilitate some of those other chemical mediators associated with pain, and of course some of those other potential benefits from overall treatment.